Last year, a patient named Mr. Lopez went home after a successful heart procedure. He felt hopeful and ready to recover, but once he got home, he became confused about his medication. Because of this confusion, he ended up back in the emergency room just 2 days later. His situation is not unusual. Many patients leave the hospital feeling confident, but small misunderstanding can quickly turn into a serious problem. Stories like his happen every day in a hospital across the country. They show why hospital readmissions are a serious issue and why it deserves attention. Today, I will explain what hospital readmissions are, why they matter, and how hospitals can help prevent them so patients can recover safely at home. Patient readmission happens when a patient returns to the hospital within 30 days after being discharged for the same or a related health problem. According to the Center of Medicare and Medicaid Services, avoidable readmission costs the U.S. billions of dollars every year. This readmission also places stress on patients and families who often feel scared, frustrated, or unsure about what went wrong. For many people, going back to the hospital feels like taking a step back in their recovery. One of the best ways to reduce the readmissions is by improving the discharge process. Good discharge planning begins as soon as the patient is admitted. Before the patient leaves the hospital, healthcare teams make sure they understand their medication, follow-up appointments, and care instructions. Nurses might review each medication one by one and explain possible side effects and check that the patient knows how to take them correctly. Doctors might talk about warning signs to watch for at home. Even a simple step like scheduling a follow-up appointment before the patient goes home can prevent confusion and reduce the chance of returning to the hospital. Another important strategy is transitional care. Transitional care means supporting patients after they leave the hospital. Hospitals call the patients within a few days to check on their recovery, answer questions, or remind them about their appointments. Some patients receive home health visits where nurses help with wound care, medication management, or mobility. Others use remote help to monitor heart rate, oxygen level, or blood pressure. These services can catch problems early and give patient confidence during recovery. When patients know someone is checking on them, they feel less alone and more supported. Hospitals are also paying more attention to social factors that affect health. These are everyday challenges that can make recovery harder, such as access to healthy food, safe housing, or reliable transportation. For example, a patient might miss a follow-up appointment simply because they don't have a right to get to one. Another patient may struggle to take medication correctly because they cannot afford them. Many hospitals now work with the community organizations to connect patients with food programs, transportation services, or housing support. When patients have these basic needs met, they're more likely to recover successfully and avoid going to the hospital. In conclusion, patient admission more than a statistic. They affect real people like Mr. Lopez and many others. Readmission can interrupt recovery, create financial stress, and cause emotional worry to patients and their family. By improving discharge planning, providing strong follow-up care, and addressing the social needs patients face at home, hospital can reduce readmission and help people heal safely. The goal is not only to keep patients out of the hospital, but also to support a healthier, safer life for them and their family. When patients feel prepared, supported, and cared for, they have a much better chance of recovering well.